Good evening. My name is Carrie McBride, and I am the team leader, as well as a member of Team C with Meredith Love, Susan Lacey, and Brittany Paracaz. We have decided to do our Taking Action presentation on full practice authority for nurse practitioners. Thank you. Advanced Practice Registered Nurses, also known as APRNs, do not currently hold an independent practice license throughout the country, and the law is held at a state level to decide who can practice independently and who cannot. In most states, nurse practitioners shall only perform medical acts of diagnosis, treatment, and operation pursuant to a protocol between the nurse practitioner and a licensed doctor, osteopathic doctor, or dentist. Nurse practitioners currently must pass a national certification exam to be able to practice, as well as keep up to date with current practice changes and continuing education. Due to the shortage of physicians, if nurse practitioners have the ability to have full practice authority nationwide, they will be able to improve patient health and outcomes, along with increased access of care and other healthcare services. Nurse practitioners have been working under the protocol of medical doctors, osteopathic doctors, and dentists for over 50 years. Nurse practitioners are able to evaluate patients, diagnose, order and interpret diagnostic tests, initiate and manage treatments, including prescribing medications, all within the written protocol and practice under a physician's license. The Institute of Medicine, the IOM, recommends the removal of the scope of practice barriers for nurse practitioners and allow them to be able to practice to the full extent of their education and training. With the predicted shortage of over 90,000 physicians by 2020, nurse practitioners would be able to fill the gap and continue treatment and continue treating patients and improving outcomes. Research from countries already allowing independent practice for nurse practitioners has shown decreased readmission rates, decreased costs, and fewer days spent in the hospital, along with higher level of patient satisfaction. Also, with the baby boomers and aging population growth, the demand of healthcare services is going to increase even more over the next couple of years. A nurse practitioner is prepared to practice in an expanded role to provide healthcare to individuals, families, and/or groups in a variety of settings, including, but not limited to, homes, hospitals, institutions, offices, industries, schools, community agencies, public and private clinics, and private practice. Conducting comprehensive health assessments aimed at a health promotion and disease prevention, diagnosing and managing common acute illnesses, referring as appropriate, and managing chronic conditions are just some areas in which nurse practitioners practice. According to Sherwood, even with advanced education, the legal authority in some states is still limited. There are currently 22 states, plus the District of Columbia, permitting nurse practitioners to diagnose and treat patients and prescribe medications without physician oversight. There are 7 states that require physician oversight to prescribe medications, and 21 states requiring physician oversight for nurse practitioners to diagnose, construct treatment plans, and prescribe medications. Proposing this policy change for nurse practitioners who are advanced practice registered nurses would be beneficial for ourselves as well as society and patients. According to the American Association of Nurse Practitioners, also known as the AANP, Nurse practitioners have provided primary, acute, and specialty healthcare services to patients of all ages for over 50 years. As of 2018, there were more than 248,000 licensed nurse practitioners in the United States, with that number continuously growing every day. There are many advantages of changing the policy and giving nurse practitioners full practice authority. These advantages include improving patient health outcomes, improving patient access to essential healthcare services, decreasing the cost of healthcare, protecting patient choice, decreasing the wait time in overcrowded emergency rooms, and increasing healthcare delivery to be more efficient. If nurse practitioners had full practice authority, there would be a greater availability of practices throughout the country, predominantly in the rural and urban areas. With the physician shortage growing, nurse practitioners will be able to close the gap with the ability to have an independent practice. This gives patients better access to healthcare with decreased wait times to see a medical professional. Many physicians' offices have booked schedules with minimum openings to see patients. Nurse practitioners with independent practice would allow for patients to see a provider in a timely manner. Patients also have the ability to choose who they see as a practitioner. Full practice authority will allow patients the autonomy of choosing their healthcare provider. Also, by providing nurse practitioners with full practice authority, we will be able to eliminate any delay of care that occurs due to physician-only services, such as a required signature, advanced directive conversations, and the initiation of treatments. One disadvantage to the implementation of full practice authority for nurse practitioners is more liability. Currently, if a nurse practitioner practices under physician protocol, their license is protected by the physician and the facility at which they are employed at. If practitioners had full practice authority, they would need independent liability insurance to cover practicing on their own. Physicians also believe that the policy is a disadvantage for them because they may lose their sense of autonomy or control. Currently, physicians have the control over the plan of care for patients, and the nurse practitioner must follow and abide by the plan. If nurse practitioners have full practice authority, the plan of care and treatment is constructed by the nurse practitioner, with little to no input from the physician. If the policy were to remain as it is, healthcare would stay the same with overcrowded emergency rooms, limited access to care, increased costs, and less efficient healthcare. If nurse practitioners were granted full practice authority nationwide, there would be a lot of change over time that can increase the efficiency of healthcare in hospitals, urgent cares, and private practices. If the new policy for nurse practitioners, known as full practice authority, were implemented nationwide, it would help the healthcare field in a numerous amount of ways. First of all, this can assist states in addressing the primary care provider workforce shortage by eliminating the unreasonable authoritative restriction of requiring physician involvement in order for a nurse practitioner to provide patient care. Therefore, it would help improve access to care, which will provide a greater access to essential state practice healthcare services in all areas of the country, especially for patients in underserved areas where urban and rural practices exist. It can give patients direct access to the full scope of services that a nurse practitioner can offer at the point of care, removing delays that are created when certain regulations require a physician signature, collaboration, or protocol before a patient can initiate treatments or obtain diagnostic tests that are ordered by the nurse practitioner. The cost of services can also be decreased because this policy avoids duplication of services and billing costs associated with unnecessary physician oversight of nurse practitioner practice. Not only decreasing the repetition of cost, it will also decrease the repetition of orders, office visits, and care services. Lastly, it will allow patients to see the healthcare provider of their choice, providing autonomy. The full practice authority for nurse practitioners has already and will continue to decrease the cost of healthcare. For example, the current average cost of a preventative health care visit is $17 cheaper in states that have already implemented the policy change compared to the ones that have not. An example for the future costs of the policy change is North Carolina's prediction. North Carolina has predicted the policy change would save the state's health system $477 million, along with adding $244 million to the state's payroll and $20.7 million to local and state tax revenues. The feasibility of the policy change is good. 22 states and the District of Columbia have already granted nurse practitioners full practice authority, and all of the Veterans Administration medical centers have allowed full practice authority for nurse practitioners. Currently, in Virginia, physicians are against full practice authority for nurse practitioners. The current practice is that a family nurse practitioner must practice under a physician for 5 years before they can seek full practice authority. Florida has started the process, and the bill has been filed to authorize full practice authority within the House of Representatives and the state Senate. North Carolina has also introduced the bill to authorize full practice authority. Evaluation of this proposed policy change would include monitoring each state's legislators' input and support of the change to full practice authority for nurse practitioners. The policy supporters for the state of Virginia include the Virginia Council of Nurse Practitioners and the Virginia Association of Doctorate of Nurse Practitioners. The American Association of Nurse Practitioners, also known as the AANP, has offered to support any organization and state stakeholders that wish to bring the fully practice authority policy to the legislator. As of February, Florida has filed House Bill 821 to authorize practice authority for advanced practice registered nurses in the House of Representatives, as well as State Bill 972 in the Florida State Senate. Also, in North Carolina, the Modernized Nurse Practice Act, which states a bill designed to reduce burdensome regulations and allow full practice authorities of advanced practice registered nurses, was introduced in February as House Bill 88 and State Bill 73. Advanced practice registered nurse, or nurse practitioners as we know them, are licensed practitioners who currently must practice medicine under a physician's protocol and have been practicing for over 50 years. Nurse practitioners diagnose and treat patients in all healthcare settings, including emergency departments, acute care facilities, and family practices. Our proposed policy change is to allow full practice authority for nurse practitioners under federal law nationwide. Not only would this improve patient outcomes, but increase accessibility to healthcare nationwide, improve quality of care to patients, decrease hospital and family practice wait times, and decrease the cost of healthcare. Nurse practitioners should have full practice authority throughout the country instead of varying by state. Thank you.